5 things that you need to know about peanut allergy. Number 1, sensitization is not the same thing as allergy. So just because you have a positive skin prick test or you have a positive blood test doesn't mean that you have a food allergy to peanut. So food allergy, currently the diagnosis is clinical. It means that if you've had the food and then you have a reaction after it, which I've described in my food allergy video, only then can you make a definitive diagnosis of food of peanut allergy. So sensitization is not equal to allergy. Number 2, this is one allergen where I would recommend component testing. So component testing is any protein like peanut protein has different kinds of protein within it that cause the allergic reaction. So for example, for peanut, ara H2 is associated with a severe reaction, whereas ara H8 is cross reacts with birch pollen and it's usually a milder reaction. So to know what component you're actually reacting to may be helpful for your peanut allergy. It can help predict the course of your allergy and the outcome and predict how severe your reaction will be. Number 3, uh, there is prevention for peanut allergy. So I know as doctors and as allergists, there was a lot of misinformation that was given somewhere in the 1960s and 70s where we wanted mothers to even avoid taking peanuts when they were pregnant and avoid giving allergenic foods to children. And I want to personally apologize because the new data and the research has shown what the age old practice was to introduce allergenic foods early. So early introduction of allergenic foods as early as 4 to 6 months of age and for peanut in the form of peanut butter can actually prevent peanut allergy from developing. I know as parents, especially I am a mom, and I know we're very scared about introducing peanuts to our kids, but early introduction is the key. Okay, number 4. Peanut allergy is actually the only food allergy for which an oral immunotherapy is approved. Palforzia is the brand name of the peanut oral immunotherapy, and it's FDA approved for treatment of peanut allergy. I know I've said this before, food allergies cannot be treated, they can only be prevented or managed. But peanut allergy, there is an oral immunotherapy. It's not really a treatment, more like it's a desensitization. So it reduces the amount of reaction that your body mounts when it uh, eats peanuts. In that, you give a small dose of peanut to your body every day, go up, and up, and then it lasts for a long time. I want to drop a few truth bombs about the peanut oral immunotherapy. Firstly, it's a long time commitment. It's not just a one and done thing. It's something that you have to take every day for a long duration of time, and even after that, continue using peanuts in your diet on a regular basis. Number 2, it's a risky thing. There are risks associated with it, and it has to be done under the supervision and under the guidance of an allergist. Number 3, it's expensive, it's not cheap. So if you're planning to go into it, you have to take all these considerations in mind. Okay, number 4, peanut is safe if you're taking it in refined oil. So refined peanut oil does not cause allergic reaction, and in fact there are many medical drugs, such as there are drugs for eczema like Dermasmooth, which uses a topical corticosteroid in peanut oil, and that is approved for use in peanut allergic patients because refined peanut oil is not allergic. However, please be careful that this is only for refined peanut oil, and you may be exposed to unrefined peanut oil, especially in some cuisines such as Asian and Southeast Asian cuisines may use unrefined peanut oil, and that can cause allergic reaction. Okay, so those are my 5 points, things that you must know about peanut allergy. Just a bonus for anyone who's listening. So, peanut, even though it says peanut, it's not a nut, it's actually a legume. So, it's in the same family as your chickpea, kidney beans, peas, soy, and not in the same family as almond, pistachio, cashew. So just because you have a peanut allergy does not mean that you will react to other tree nuts. They're not even in the same family.